Geisinger Medical Center in Danville held a roundtable discussion on opioids with Senator Pat-Toomey on Tuesday.
I think one of the few things that people know that our coroner, Scott Lynn and Terrence Lynn, will share with us is that Montour-County has the highest opioid death rate per thousand of any of the counties in the state of Pennsylvania. At the county level, we've been struggling with our budget for the last several years. Our coroner budget has more than tripled as a direct result of this impact. Our jail costs have increased, our judicial costs have increased.
2 years, we've seen an increasing amount of drug overdose deaths that have both taxed us financially, the county, as well as staffing-wise for our office. We face many issues. A simple toxicology test can be anywhere from $500 to $1,000 to the county, along with the autopsy. If we're going to prosecute or attempt to prosecute, the autopsy itself is $2,000.
I mean, it is absolutely a finance-driven decision, and that's tough because there are times when I'm not receiving information on a particular death until 2-3 weeks, a month down the road, and at that point we've passed our window.
We've actually prevented 2 deaths because of our naloxone program, and we've actually had community members who had provided this naloxone to somebody who was suffering from an opioid overdose and had prevented the death of a 20-year-old and also a 38-year-old male. I think that's significant. And I think one of the things that we need to look forward to is how do we get these people help, because there's not a lot of providers in rural communities that can handle patients that have opioid use disorder.
Having been a nurse and worked in this industry for decades, I have never seen anything like it. I mean, it is the largest public health crisis. The reason that it has gotten so bad is really we have a tremendous stigma associated with treatment, a tremendous stigma associated with the disease of substance abuse disorder. And I would ask you, Senator, that I always asked when I was the secretary, and I would ask now, is that we have to start changing the conversation, both the federal, state level, to start funding education campaigns in terms of prevention from the disease from ever starting, but also somehow we have to change the culture on stigma.
Use and abuse and addiction and overdoses is the most important public health crisis of our time, and it is devastating here in Montour County as well as throughout really almost every place in Pennsylvania. Fortunately, there are healthcare providers who are really stepping up and responding, and it was fascinating to hear about Geisinger's work in this area, and especially the decline in the volume of prescriptions.